The human body sometimes hides extreme biological mysteries. Through these 10 stories of survival and transformation, let us discover how science and willpower transcend disability to restore dignity. These are journeys that redefine universal hope. Number 10. Yang Jianbin. The battle against a 110-kilogram burden. The story of Yang Jianbin, a man from China, is among the most documented and impressive cases of neurofibromatosis in the annals of world medicine. At birth, nothing foretold such a fate, save for a small birthmark at the base of his back. However, what seemed to be a simple skin anomaly was actually the precursor to a rare and devastating genetic condition. Over the decades, this mark transformed into a colossal tumor. By 2014, the mass had reached a record weight of 110 kilograms, well over the average weight of an adult man. This growth enveloped his hip and right leg, condemning him to total and painful immobility. The challenge posed to Beijing surgeons was titanic. The operation required meticulous planning involving dozens of specialists. The primary danger lay in the tumor's vascularization. Every incision risked causing a fatal hemorrhage. During 16 hours of high tension, doctors worked to free Yang from this weight. They had to remove the mass in sections while managing massive blood loss, requiring numerous transfusions. The success of this intervention was hailed as a major surgical feat. Beyond the technical prowess, a new life was given to Yang. After years of rehabilitation, he was finally able to stand, freed from a burden that had literally pinned him to the ground for a large part of his existence. Number 9. Alex Lewis. Rebirth after the invisible threat. In November 2013, Alex Lewis, an ordinary family man, thought he had contracted the seasonal flu. Within hours, his condition deteriorated dramatically. What he believed was a simple virus was actually a lightning-fast infection caused by Group A Streptococcus. This bacteria triggered toxic shock syndrome and necrotizing fasciitis, a disease where the body's soft tissues are literally eaten away by the infection. To prevent the necrosis from spreading to his vital organs, doctors had no choice but to proceed with the amputation of his 4 limbs and a complex facial reconstruction, as his lips had been destroyed by the infection. Alex Lewis's journey has become a global symbol of resilience. Instead of sinking into bitterness, he chose to document his reconstruction to inspire others. He had to relearn the simplest gestures: eating, brushing his teeth, and walking with state-of-the-art prosthetics. His face was restored thanks to skin grafts taken from his own body, a masterpiece of craftsmanship performed by plastic surgeons. Today, Alex is a speaker who travels the world. His message is simple but powerful. The loss of the body does not mean the loss of identity. His iron will has allowed him to resume sporting activities like kayaking and hiking, proving that the human spirit possesses an adaptive capacity that science is only beginning to understand. Number 8. Huang Chunkai, the Elephant Man and the Quest for Normalcy. Huang Chunkai lived for decades in the shadow of extremely aggressive neurofibromatosis. Nicknamed the Elephant Man by the media due to the spectacular deformation of his face, he carried a 15-kilogram tumor that hung down to his waist. This mass did more than just change his appearance. It exerted such pressure on his spine that he became unable to stand straight. His eyes were covered, his ears stretched, and his ability to eat was gravely compromised. For years, his family, living in a poor rural area of China, could not afford his care. It was in 2007 that his fate changed, when a hospital in Guangzhou agreed to take on his case free of charge. The risk was immense because the tumor was saturated with fragile blood vessels. Surgeons had to perform several operations, spaced out over several years to remove the mass progressively. Every step was a battle against death. Ultimately, the doctors succeeded in removing the majority of the tumor, giving Huang back a human face and restored mobility. His courage in the face of pain and social stigma moved millions of people. Today, Huang is a symbol of dignity, showing that even in the face of the most cruel genetic mutations, modern medicine can offer a second chance. Number 7. Kambu Sai. The race against time against lymphoma. The case of young Kambu Sai in Ivory Coast illustrates the brutality of pediatric pathologies in certain regions of the globe. Kambu was struck by Burkitt's lymphoma, a cancer of the lymphatic system characterized by one of the fastest cell proliferation rates in the world. In just a few months, a mass developed on his face, deforming his chin and cheeks in a way that obstructed his airways. In his village, due to a lack of diagnosis, people feared the worst. Without immediate intervention, the young boy risked asphyxiation or vital organ failure. Thanks to the intervention of international NGOs and local doctors, Kambu was transferred to a specialized center. The treatment protocol was intensive, combining aggressive chemotherapy to reduce the tumor from the inside and surgical interventions to remove residual tissue. The images of his transformation are striking. The swollen and unrecognizable face gave way, after a few months of treatment, to the smile of a child full of life. Kambu's story highlights two crucial points: the formidable effectiveness of modern oncological treatments when applied in time, and the vital importance of international medical solidarity to bridge inequalities in access to basic healthcare. Number 6. Marley Casillas, sculpting bone to restore life. Marley Casillas, a young Haitian girl, suffered from a rare and severe form of polyostotic fibrous dysplasia. This non-hereditary genetic disease causes the replacement of normal bone with fibrous tissue, leading to massive deformations. In Marley's case, the disease targeted her face, creating a 7-kilogram tumor that threatened to crush her eyeballs and totally block her nasal and oral passages. She could no longer eat solid food, and her vision was decreasing day by day. In 2005, she was flown to Miami to undergo an operation that would change her life. The surgical intervention lasted 17 hours. Surgeons had to literally sculpt her new face by removing the fibrous tissue and reconstructing the bone structure with titanium plates. It was one of the most complex facial reconstructions ever performed on a patient of that age. It was a total success. Beyond survival, Marley regained the ability to speak clearly and smile. Her story was followed by millions of television viewers, raising public awareness about this little-known disease. Today, Marley leads a normal life, far from the physical threat of the tumor, a reminder that reconstructive surgery is, above all, the surgery of function and human identity. Number 5. Tessa Evans, 3D innovation for a future without a nose. Tessa Evans was born in Ireland with an extremely rare condition called congenital arrhythmia. She came into the world without a nose, without nasal cavities, and without an olfactory system, an anomaly that concerns only a handful of cases in medical history. Despite this absence of a nose, Tessa grew up as a joyful and energetic child, but the medical challenges were very real, particularly to ensure her breathing during sleep and to prevent infections. Traditionally, nasal reconstructions are only done in adolescence after bone growth, which leaves the child with a major physical difference throughout their childhood. For Tessa, doctors opted for a revolutionary approach: the use of 3D printing. They designed a personalized prosthesis inserted under the skin of her forehead, which acts as a mold to stretch the tissues and create the shape of a nose. As Tessa grows, the prosthesis is replaced by a larger one, thus preparing the ground for a final, more aesthetic, and less invasive surgery in adulthood. This innovative technique avoids the heavy scarring of traditional grafts. Tessa's story is a magnificent example of how cutting-edge technology can be put at the service of a child's psychology, allowing her to grow up with a positive self-image despite a fundamental biological difference. Number 4. Josiah Vieira, greatness of soul in the face of accelerated time. Josiah Vieira had progeria, also known as Hutchinson-Gilford syndrome. This extremely rare genetic disease causes accelerated aging of the organism, about 8 to 10 times faster than normal. Children with progeria often have the appearance of elderly people, suffer from arthritis and premature cardiovascular problems, and have a limited life expectancy. Josiah, however, refused to be defined by his physical limits. Passionate about sports, he became an icon for the State College Spikes baseball team, serving as a mascot and moral advisor for the players. Although Josiah was never able to run the bases like his heroes, his presence on the dugout bench transformed the team's mentality. He taught the athletes the value of gratitude and the courage to fight every day. Josiah passed away in 2018 at the age of 14, an advanced age for a child with progeria. His legacy lies not in his disease, but in the emotional impact he left behind. His journey reminds us that life is not measured by the number of heartbeats, but by what we do with every moment. He remains in memory as a little warrior whose mental strength far surpassed the fragility of his body. Number 3. Stefan Zolik, the end of a decade of silence. Stefan Zolik, a Slovakian mechanic, lived a physical nightmare for over 10 years. He suffered from Madelung syndrome, a rare disease characterized by the growth of massive lipomas, fatty tumors, around the neck, shoulders, and upper limbs. In Stefan's case, a 6-kilogram tumor had developed under his chin, stretching from one ear to the other. This mass was so imposing that it prevented him from turning his head and forced him to stay cloistered at home to avoid mockery and persistent stares. In 2014, Stefan was finally able to be operated on. The surgery lasted 5 hours, a relatively short time compared to other cases, but the precision required was extreme to avoid damaging the facial nerves and carotid arteries. When Stefan woke up and looked in the mirror for the first time, he burst into tears. "It's incredible to feel free again," he declared. His physical transformation had an immediate impact on his mental health, allowing him to resume a normal social life. This case demonstrates that even conditions that seem merely cosmetic can actually be physical and psychological prisons that only expert surgery can liberate the patient from. Number 2. Charmaine Sahadeo. Courage in the face of thousands of neurofibromas. Charmaine Sahadeo, originally from Trinidad and Tobago, suffers from the most severe form of neurofibromatosis type 1. Her skin is covered with thousands of small tumors, ranging from the size of a marble to a golf ball. These tumors eventually obstructed her vision, blocked her nasal passages, and made walking extremely painful. For years, she lived in constant physical pain, exacerbated by brutal social rejection. Her condition was so advanced that many doctors in her country feared to intervene, thinking it was impossible to remove so many masses without putting her life at risk. In 2024, thanks to international media coverage, she was taken into the care of Dr. Ryan Osborne in Los Angeles. This exceptional surgeon undertook a 60-hour surgical marathon, spread over several weeks. He removed the most bothersome tumors one by one, freeing her face and legs. Charmaine's courage throughout this process was exemplary. She had to undergo repeated anesthesia and painful post-operative care, but her desire to see her grandchildren grow up without being afraid of her carried her through. Her story is a lesson in perseverance in the face of a chronic pathology that seems, at first, insurmountable. Number 1. Didier Montalvo, the liberation of the turtle boy. Didier Montalvo, a young boy living in a remote village in Colombia, was born with a giant congenital melanocytic nevus. This skin anomaly caused the growth of a dark, thick mass covering his entire back, which earned him the cruel nickname Turtle Boy. In addition to physical discomfort and the permanent risk of infection, the tumor presented a 10% risk of transforming into malignant melanoma, skin cancer. Socially, Didier was ostracized, with some villagers even believing his condition was the result of a curse. His story attracted the attention of Dr. Neil Bulstrode, a renowned British surgeon, who traveled to Colombia to operate on him for free. The intervention consisted of delicately removing the shell and performing skin grafts taken from other parts of Didier's body to cover the exposure. The operation was a resounding success. Didier was finally able to remove his t-shirt without shame and run like any other child his age. His transformation was not only physical, it changed the perception of his entire village. Didier was able to return to school and envision a healthy future, proving that human compassion is the most powerful engine of medical progress. Number 11. A moment for unforeseen cases. These 10 stories illustrate how technology and empathy push back the impossible. Driven by the obstinacy of doctors and the courage of patients, they remind us that every life is precious, placing human dignity at the very foundation of care. Take care of yourselves, my dears. See you soon!